name's Dr. Nita Hines, and I work at the Seattle Humane Vet Clinic. I'm here to talk about Micah, who is one of our longtime residents at the shelter, and he has had quite a few medical conditions during our care, and he's been lucky enough to receive some pretty invasive surgeries and procedures to help him get back on track. So we wanted to chat about some of those things today and what he's gone through and what an adopter can expect. One of the issues that Micah has is that he's torn some knee ligaments, and so he's actually had surgeries on 2 of his knees, and one of them happened quite recently, so he's currently getting the rehab and the care that he needs. Unfortunately, it can be kind of a common thing, especially in our boisterous, young, loving dogs. Sometimes the ligaments in their knees can actually tear, and sometimes they're little micro tears, but sometimes they can be bigger and completely rupture. And this is very similar to when humans get an ACL tear in their knee. So for all of those of you watching that have had some knee issues, I'm sure you can sympathize with Micah. So in his case, he had already had a procedure on one knee, and then one day he was becoming what we call toe-touching lame, which means he was limping and just barely putting weight on that one paw on one of his legs, and we determined that he actually tore his ACL, though we call it CCL in veterinary medicine, his cranial cruciate ligament, and he had torn it on his other knee. And unfortunately, that is also not uncommon that if they rupture the ligament in one knee, that can happen in the other knee as well. So we had a wonderful surgeon come in and do this procedure with him. And so what he got was something called a TPLO, which is a surgery where we basically change the angle of the tibia, which is one of the bones involved in the joint, so that the knee is stabilized again. And luckily, this is a really good procedure, and usually they recover very well. Right now, he's in the rehab process, which means that he's at home resting, getting all the love from his foster parent. And it's kind of tough for Micah because I think he really likes to be active, so unfortunately, he has to stay nice and calm and quiet. He's on multiple medications to make sure he's not painful during this period. And over time, though, as it's healing, we would like him to start weight bearing on that leg and do some rehab activities to get that muscling back, to help stabilize the knee and get him back to, hopefully, normal activity. So that's exciting, and hopefully he's going to do really well with that. But an adopter should know that obviously both of his knees are abnormal at this point, and sometimes they can have secondary follow-up injuries like meniscal tears, which again happens in human medicine too. And so he might need some chronic care to manage the comfort of his knees. It's possible, hopefully not, but it's possible that he might have to have another surgery in the future. If we had a crystal ball, we could let you know, but we don't. What I would envision for him is hopefully he will have really good mobility and do really well long term, but he can also develop arthritis in his knees because at this point there's been a lot of inflammation in there, and his knee joint kind of works differently now. In terms of other conditions that he's been treated for, we've noticed that sometimes he has maybe some mild allergies, some mild skin irritation, so he's been kind of treated on and off for little cases of that, little flare-ups, but generally he's been quite comfortable. Micah was diagnosed with a fungal infection inside his nose, and so what happened is that Micah started having this nasal discharge, chronic sort of nasal drip coming out of his nose that his foster parent noticed and reported to us, and sometimes there was some blood in there too. And so we started off by doing some basic things. We did blood work on him. We made sure he didn't have a blood clotting issue. We took x-rays of his skull. We tried to do a biopsy of nasal tissue, and we were struggling to figure out what was going on with him. And so we consulted with an internal medicine specialist, and they recommended a couple more tests and thought that he probably had a nasal infection in his nose. And that's called aspergillosis. This is an organism that's kind of in the environment, can be in the soil, but typically when we see dogs infected with it, they're from certain parts of the United States. That's when we see the infections most commonly. And so he actually originally is from Texas, and so he would probably have been brewing that infection in his nose for a while. In Micah's case, we didn't see any evidence of it having spread to his lungs or other places, so hopefully that didn't happen, and we got him the treatment as soon as we knew that he had this issue. So his foster parent was really loving and involved in his care, and we were able to schedule him to see a specialist, and he got a CT of his head, and then he got rhinoscopy, which basically means they looked up his nose with like a little video, and they were able to see the fungal plaque in his nose, and so they cut away as much of it as they could, and then they put a topical antifungal ointment on there. And he's been doing great since, actually. Sometimes they need repeated treatments, and sometimes the treatment's not successful. But in his case, his nasal discharge has resolved, and so the internal medicine specialist has told us for now, it seems like he's doing great, and so hopefully that is completely resolved. But of course, the doctors should know that that is something he's been treated for, and we can't guarantee that he might not have some complications from that in the future.